And now I'd like to introduce our host today, which is my colleague Holly Ryder-Milkovich, who many of you know. But for those of you who don't know her, Holly is the Senior Director of Prevention Education at EVERFI. Previously, Holly directed the Sexual Assault Prevention and Awareness Center at the University of Michigan. And she provided expertise to President Obama's White House Task Force on best practices for campus-based sexual and intimate partner violence prevention and response efforts, and also represented four-year colleges and universities in the Federal Negotiated Rulemaking Committee for the 2013 Violence Against Women Act reauthorization. Holly brings over 2 decades of experience in violence prevention and response in higher education to a role at EVERFI. So I'd like to welcome Holly today, and she will be introducing our presenter. So Holly, thanks for joining us.
Oh, thank you so much, Michele. And I have to say, I have been so excited to bring Dr. Michelle Monroe's research and work to a wider audience of prevention professionals on college campuses. I think one of the things that we have struggled with as a field of practitioners is understanding both that we need to be providing culturally appropriate, adapted programs for the different populations that our campuses serve, and also really struggling with the dearth of those programs out there that may already be designed for those specific communities that we are seeking to engage in prevention activities. And this is really where Dr. Monroe-Kramer's work is going to come to the full focus, is to be providing the support for campuses to do that work. So Dr. Michelle Monroe-Kramer is a assistant professor at the University of Michigan School of Nursing. Her program of research focuses on trauma, comprehensive care of vulnerable populations, and missed opportunities for care within domestic and international contexts. Her research projects approach these topics using trauma-informed and patient-centered lens, and she uses mixed methods and participatory action research to understand those experiences of vulnerable populations in order to inform future intervention developments. And you're going to see so many of these strategies at play in the work Dr. Monroe-Kramer is going to share today. Dr. Monroe-Kramer has also developed the first undergraduate elective course at the University of Michigan that's focused on gender-based violence from theory to action, the course that is cross-listed across campus, and that really supports students in engaging meaningfully in violence prevention in an informed way, both on campus, and supports their future action going forward. I'll just additionally note that I've had learned so much from Dr. Monroe-Kramer in our time together at the University of Michigan, where Dr. Monroe-Kramer first began as a doctoral student volunteer with the Sexual Assault Prevention and Awareness Center, had a deep role in creating some of the interventions at play at the University of Michigan, and who has been an invaluable partner on the faculty side to the work that's happening at the University of Michigan. So a faculty member who has deep experience and knowledge with working with students in the student context, which is just another reason why I'm so excited to share Dr. Monroe-Kramer's work today. And with that, I will turn it over to you, Dr. Monroe-Kramer, to share more about the adapted model.
Great, thank you so much, Holly. I'm excited to be here today to talk about the adapted process. It's something I've been using quite frequently over the last few years. So to start, I would like to just give a quick overview of what we will be talking about today. This webinar will introduce the use of a research-informed adaptation process to target prevention programs for specific populations. I am particularly going to describe this model to adapt a sexual violence primary prevention intervention targeting students from a university in the United States to one in Ghana. We will also discuss the potential this model holds in systematically adapting pre-existing evidence-based sexual violence interventions to reach diverse student audiences. So you can see the objectives listed here for our session. Due to time constraints, there are a few slides that I will go over rather quickly, These slides can be extremely useful, though, if you decide that the adapted model might be useful in your work. So I really do think that supplying the slide deck is going to be important in the future because we've clearly laid out the process of the adapted model as well as how we've undertaken that process. So it can definitely be a useful resource to revisit at future times if you decide to move forward with this process. And before we get started, I would like to thank my research team and partners. This work has included a rich interdisciplinary team. At the University of Cape Coast in Ghana, our faculty colleagues are Eugene Darta in the Department of Population Health and Professor Akua Britwam, who is the director of the Center for Gender Research, Advocacy, and Documentation. This is also called SAGRAD and is equivalent to the University Sexual Assault Center. At the University of Michigan, I have worked closely with my colleague, Dr. Sarah Ruminsky, who is actually supposed to be here today to help give this presentation, but incidentally, she is returning from Ghana and hasn't made it back yet. As well as a group of dedicated students at the Sexual Assault Prevention Awareness Center and SEXPER team, we worked closely as well with the staff at both of those centers. So adaptation, why do we care about adaptation? When we think of creating prevention programs or sexual violence interventions, we often first consider creating programs tailored to our specific needs. Despite our diverse locations, populations, and contexts, it is important to remember that there are numerous programs and interventions that already exist that we may be able to adapt. With that being said, we know that there are definitely pros and cons to adapting a pre-existing intervention. We've made a list here of some of the pros and cons that have come up during our research procedures, but there definitely might be unique pros and cons to your specific populations or settings. Some of the pros we've identified are saving time and money, consistency in interventions across cultures and contexts, which allows for comparison, and then you're working off an already established evidence base. The cons and things that we worried about as a group, and I'm sure others will as well, are whether or not you might be missing out on community activism or support for the intervention. And this is something we'll specifically talk about during this webinar. Wondering if it will be tailored to the needs of the context, culture, or population you're working with. There is some concern about having too much consistency in interventions across cultures and contexts. You're not sure if it would be the best option for your group, and it might be based on outdated evidence and situation. So I hope to address all of these cons throughout the program today, but definitely if there are any questions about this as we get to the end of the webinar, please let me know. So the crux of our conversation today will be centered on this adapted model. And the adapted model is a systematic framework for adapting evidence-based interventions that was introduced in 2008 specifically for HIV intervention. And that is where this model has been used consistently since it was developed. It has been used to adapt interventions to new locations, new cultural contexts, and new populations, but always within that kind of HIV framework. And the other thing I wanted to point out on my slides, you'll also notice I included the references for anything that is referenced on the slide. So the individuals who created this model are Wingwood and DiClemente, and I find that their article reference there, even though it does reference an HIV intervention, is also very helpful in describing the adapted process. So looking through the adapted model, it involves 8 steps, and generally these steps are done in a systematic manner, moving from number 1 to number 8. So the first step is assessment, and this can be assessment of the priorities of the new population, the new location. Next is decisions, and this is really where the either research team or the individuals who will be implementing the program make decisions on whether or not to adapt an intervention, create something new, or determine what actually needs to be adapted. The third step is administration of the intervention. Fourth is production of an adapted version. Fifth are topical experts. 6 is integration of feedback from the topical experts into the adaptive intervention. 7, I put training students, but this could be training any facilitators or individuals who will be involved in deploying the intervention or program. And then 8 is testing the adapted intervention. So for the rest of the webinar, we're actually going to go through each of these 8 steps in a systematic manner with a demonstration of what we have done in past projects. So to illustrate the adapted model, I would like to walk through our use of the model in Ghana. And so we adapted something called Relationship Remix to a new program called Relationship Tidbits. So before we dive into the adaptive process and how it might apply to your needs, I think it is important to provide some background on the type of intervention we adapted. We would like you to keep in mind that we are giving a rather time-intensive example of adapting a peer-delivered intervention to a new country and a new context. And we recognize that not everybody is adapting programs to a new country. However, we will also discuss other examples where this process could be used to adapt a technology-based intervention to a new population or a new topic. So first of all, what is Relationship Remix? It is a primary prevention intervention that was developed at the University of Michigan in 2011 by a group of faculty and staff from the housing, a sexual health group called Sexper Team, and then our Sexual Assault Prevention and Awareness Center. It is currently delivered as an interactive in-person training. It's about an hour and a half long to all first-year students, and it's delivered by peers with a focus on healthy relationships and consent. And the most important thing for our group is that it uses a values-based framework. And this was important because we thought a values-based framework really could be adapted or translated to a new culture or a new context like Ghana. The other thing that is important about Relationship Remix is it is a building block curriculum. So when you work through the curriculum, each topic area builds on the previous content. This is currently delivered within residence halls at the University of Michigan. And so that was definitely something we kept in mind when going through this process, whether or not we wanted to replicate the delivery method as well as the content. This slide includes a lot of information, but it's basically an overview of the building block components of Relationship Remix. And I point this out because we will come back to it when describing the adaptation process, because we did have to make some changes from this and actually ended up adding an additional building block as well. There is an evidence base on Relationship Remix. Over the last 5 years, more than 18,000 students have received the program at the University of Michigan. And a recent analysis of data from about 2,300 students in 2015 found that the program made significant changes in values-based decision-making, knowing how to ask for consent, and relationship communication skills. So this is the program we went into Ghana with kind of in the back of our head. So I just want to take a quick pause to see if anyone has any questions at this time, or if Holly has anything she would like to add. All right, it looks like the questions have been answered, so we'll go ahead and move forward. The next thing I wanted to do is dive into the intervention we created using this adaptive model that is tailored specifically to the University of Cape Coast students in Ghana. As everyone taking part in this webinar is well aware, sexual assault is a significant challenge for universities affecting the health and academic success of students. Again, as you are all well aware, United States universities have many different programs to prevent sexual violence. However, programs such as these are non-existent on Ghanaian university campuses. For those of you who don't already know this, Ghana is located in West Africa. It's bordered by the Ivory Coast, Burkina Faso, Togo, and the Atlantic Ocean. The current country of Ghana was the British colony of the Gold Coast, And so this is important for us because there is a legacy of violence in Ghana. Ghana was an important trading site for the British government, initially for various goods, but then eventually for people who were being traded as slaves. And in 1962, 5 years after independence from Great Britain, the University of Cape Coast was established to train teachers. So the way that our project began is actually quite important. The University of Michigan has a long history of collaborations in Ghana, especially around women's health. Over 30 years ago, the former chair of the Department of Obstetrics and Gynecology helped to establish the first in-country residency training program in Ghana. And I believe this is important because it is on this foundation of collaboration and immense goodwill that our team has really conducted this work. So a couple of years ago, our colleague, Dr. Eugene Darta, was a postdoctoral fellow at the medical school at the University of Michigan. At this time, he connected with my colleague, Dr. Sarah Raminsky, around a mutual interest in reproductive health. And after some discussions, they decided to conduct a survey of residential students at the University of Cape Coast. The survey was conducted on tablet computers and asked about various aspects of students' reproductive health, including their use of contraception, their risk perception, their views about abortion, and a few questions about sexual coercion and rape. The survey was self-administered in participants' rooms. So a total of 1,044 students completed this survey. And of those students who reported that they had ever had sex, the survey asked how willing they were the first time and the most recent time. Almost 42% of the sexually active females reported they were not at all willing the first time they had sex. They asked all participants, regardless of whether or not they reported they had sex before, if they had ever been forced or coerced into having sex. In total, more than 1/4 of the females and 16.5% of the males reported they had been forced or coerced into sex or had sex when they were not at all willing. So what this study did is it gave us some data to indicate that there was a high level of sexual violence victimization among the student population in Ghana. But what it also did is indicated that further research was needed. The questions that were added on to this survey, there were only a few of them, and so they did not give us a lot of details into the lived experiences of the Cape Coast students. And so we really wanted to pursue further research as well as programming to address sexual violence on campus. The other thing that was happening about the same time at the University of Cape Coast was that they had developed the Center for Gender Research, Advocacy, and Documentation, also known as SAGRAD. And SAGRAD was founded due to poor post-assault care and demands for sexual violence prevention programming. It initially started with 2 faculty members, and their focus was on victim blaming among frontline healthcare workers and helping the survivors at the university access services. In 2015, the center revised the campus sexual harassment policy, and it was disseminated to all incoming students. Staff at SAGRAD recognized the need for violence prevention programming, but the infrastructure did not exist at the university. Those of us from University of Michigan entered into discussions with Dr. Darta and the leadership at SAGRAD, and we together decided to attempt to adapt Relationship Remix to the University of Cape Coast. We decided to use the Adapt-It framework to guide this adaptation process. So this is an extremely busy slide, and this is one of the slides that you may want to come back to at some point. But what this does is it gives you a quick overview of the entire process that we've undertaken to adapt this program. I'm going to go through each step, step by step, and give you details on that. But I wanted to point out that we started this process in February 2016 and are just finishing up this month. This has been a long process because of the cultural and contextual differences, the distance between the research teams, and the need for continued funding. I recognize that not all adaptation processes will be this lengthy and time-consuming. However, I also believe it is important to recognize that this is a systematic process. And so this example really helps us go through each step in detail. So the first step of our process is the assessment phase. And the goals of the assessment phase are to really learn about the population or the culture or the context or wherever you are working. We conducted 2 separate assessments. The first was via focus group discussions with students. Again, while we had some indications that sexual violence was a problem at the university, the survey I just described really generated more questions for us than it did answers. We knew there was quite a bit of victimization on campus, but we didn't really know anything about the assault. We also didn't know what sorts of relationships the students were engaging in. So while we thought that relationship remix might work well, we weren't totally sure and needed to assess the situation to see what the best programming would be.
Michelle, I have a quick question here from the audience. One of the questions coming in is whether or not the researchers factored in cultural bias into the survey results for the survey in Ghana.
Great. So we're actually, the first survey, they did not have a team member who really focused on sexual violence. And so the researchers kind of added those questions in last minute. For the additional surveys that I'm going to be mentioning right now, we did a process called cognitive interviewing, where we very closely went through the surveys with students across campus to make sure they were measuring what we thought they would measure, to see if any questions were kind of inappropriate, if terms were kind of more used in the United States and not in Ghana. And so we did factor that in future surveys.
Thank you so much.
You're welcome. Any other questions?
I think we're good.
Okay. So moving on to the assessment methods, as I mentioned, we conducted focus groups, and so we actually ended up conducting 4 focus groups. And we did do these in gender-separated groups, and this was by the recommendation of our Ghanaian colleagues, as well as by the student request. And so we did 2 focus groups with men and 2 focus groups with women. And we were really interested in learning about how students engage in sexual relationships, and then some of the issues around sexual assault. As I just mentioned, at this time, we also wanted to validate the evaluative measures we plan to use. And as I've mentioned as well, our team was made up with a fair number of researchers. And so the evaluation of the program was really important to us, and we wanted to make sure we were measuring the concepts and topics that we plan to address with the intervention. And so these were the scales that we intended to use initially. We wanted to measure rape myth acceptance, gender equity, and power in sexual relationships. And in a moment, I'll talk about some of the changes that we did need to make to those scales to make them culturally appropriate. So from the focus group discussions, we learned that communication around sex is mainly done through body language and actions, and that there is an expectation, especially for women, to not have sex before marriage. We learned about high levels of gender inequality within romantic relationships, and that a lot of students agree that no means yes when discussing sex, even within a committed relationship. And so basically we were told about this kind of expectation that women are expected to say no to sexual activities, even when they might be willing to engage in them or when they might mean yes. There was some degree of violence and control discussed within sexual relationships. And then unlike at the University of Michigan and other universities in the United States, alcohol was rarely discussed as a factor contributing to sexual violence. So based on this assessment, we moved into the next phase, which is the decisions. Usually in the decision phase, this is when you take what you've learned and find an intervention that will work for your goals, given the population or the context. However, we already had an intervention in mind, and that is perfectly fine. A lot of kind of adaptation processes go through this with something in the back of their head. So during our decision phase, we took what we learned from the assessment phase and started to make some very minor changes to the existing program. We also made decisions on whether or not our evaluative measures were appropriate and how or if they needed to be modified or completely replaced. So the results of this phase are that we started to shift the focus of the intervention away from alcohol-facilitated sexual assault to recognizing and trying to reduce gender inequality. We did this by adding explicit victim-blaming scenarios, adding a video on consent. We actually added the Consent is Key video, which I'm sure some of you are familiar with. And we also added a building block specifically on gender inequality. The second thing we did is we made a few changes to our evaluative measures to ensure that they were culturally appropriate. So we ended up removing a few items from the GEM scale. We removed one item from the rate myth acceptance scale, and we actually changed a fair amount of terminology to make it more locally relevant. And so one of the examples was just changing the word slut to flirt. There were some changes around kind of the description of dress or clothing that people wear. But this made sure that we had a way to begin to evaluate some of our outcomes, even though that wasn't the main focus of this process. The next step in the adaptive process is administration. So the goals of the administration phase are to pilot administering the intervention to the target group to determine if the intervention is appropriate. We also wanted to get feedback on the format and content and hear really how the participants were viewing the intervention. Often this can be done with the original intervention. At this point, we had already made some minor changes in the intervention based on our assessment and decision phases. So we went ahead and reused that revised intervention. The important thing to remember with the administration as well is that it doesn't have to be a large sample. When we conducted this process, we did this first round of beta testing in April 2016 with about 40 participants. And we really focused on students, how the students would interact with the new content in terms of understanding, participation, asking questions. We were interested in the length of time it would take to administer the revised intervention. And so the process that we used for this are that we actually delivered the intervention. We did digital audio recordings, and we took field notes to help document the process and where people were having trouble understanding things, where they were asking questions. We also started to use our pre and post test measures during this time frame, just to get an idea if we were changing attitudes related to rate myth acceptance, gender equity, and then sexual relationship power. The other thing I want to mention in regards to the administration phase is that sometimes people will use beta testing and sometimes they will use theater testing. The main differences here are that theater testing purposefully asks the participants to think aloud as they engage with the program or intervention and to give feedback as they go through that process. Beta testing focuses on having the intended audience kind of try out the intervention or program to see how it goes, as opposed to having them talk through the entire program or intervention. So the first round of administration for us showed that the intervention was very long. It actually took 3 hours and sometimes over 3 hours on average. So as you can imagine, we were definitely losing interest of many of the students involved. While a lot of the material worked well, there were some activities that the participants really struggled with that really bogged down the program. I mean, it took 20 minutes to try to explain an activity that should have took less than 20 minutes to go through with the whole group. So as part of our beta testing, I mentioned we also wanted to get an idea of whether or not the intervention was impacting outcomes. So we looked at rate myth acceptance and gender equality measures both before and after we delivered the Relationship Tidbits program. And we found some preliminary changes, including that male participants had significantly improved scores in rate myth acceptance, and both males and females demonstrated improvement in the endorsement of gender equality. And I do have a graph that shows that as well for anyone who is interested in kind of the numbers and the research component of this project. So what I'd like to do is give a quick example of why this testing is so important. So one of the activities in Relationship Remix is a game of basically 20 questions. Specifically, participants are asked to pair up, and one partner thinks of what one food they would like to take with them to a desert island. Their partner then has an opportunity to ask yes or no questions to try to guess what the food is. In the next round, the partners switch roles, and the one guessing can ask any type of question they want, so they aren't confined to the yes or no question. So when we tried this in Ghana at the University of Cape Coast, it did not work at all. It was actually a complete fail. And so we believe the reason this happened is that Ghanaian children do not play the game of 20 questions. So we had to explain the rules multiple times, which took a really long time. Further, participants were trying to determine the right or best answer. So they were trying to think about what would keep them alive for the longest time, what was going to be the healthiest food for them to have in an island, what would keep the longest. And really the point of the exercise is to demonstrate that open and honest communication leads to better outcomes. So the point was really asking, what food would you bring, to let your partner know what you're thinking more easily than a series of yes or no questions. But this concept was completely lost on our students in Ghana. So what we were able to do through this process is learn that that activity wasn't going to work at all, and we were able to try a new activity. So what we did is we kind of went back to the drawing board and thought about other activities which would get across kind of the same message about open and direct communication. And so we tried a game of telephone instead. And this worked wonderfully. The participants loved it. It got them up and moving, laughing, and made the point that messages can change a lot. We were able to demonstrate the importance of direct communication in a fun and easy to understand way, and in an activity that lasted at most 5 minutes, as opposed to the 20 minutes that it took for the 20 questions game. So the next step in this process is the production phase. And the production phase does exactly what it sounds like. It's actually creating the materials that are needed for the intervention. And for this particular program, we created a facilitator's manual, so basically a script to go through the program, as well as a facilitator's training guide. And this was to help train future peer facilitators of the program. And so these were based on the original materials from Relationship Remix, but were culturally adapted specifically to the University of Cape Coast. After we had produced our initial version of the program, the next step was to go to our topical experts. These experts are identified based on the goals of the program, the intervention chosen, and the context to which the intervention is being adapted. So basically, you want people who can give feedback on the format, the content, and the types of materials that are being produced. So you might select a topical expert based on the type of intervention. You might select an expert based on the delivery modality, or you might select an expert who developed the original intervention that you are adapting. For our program, we had staff members at the University of Michigan's Sexual Assault Program who participated in the development of the original program, as well as staff at SAGRAD, which was the center at the University of Cape Coast, because they really knew the cultural context and what the students needed. So the topical experts reviewed our adapted program, and we were actually able to give them a paper or virtual or electronic copy of the script. And they were basically evaluating it to make sure it stayed true to the original program, so that values-based framework. And then they were also giving feedback on changes we made as to their cultural relevance. So usually at this point, you would be able to kind of move on to the integration phase. However, since our adaptation was a completely different context, we actually decided that we needed to repeat some of the steps again. And so we repeated the decision, administration, production, and topical expert phases again. We really felt we needed more information to make this intervention appropriate for the Ghanaian context. And so this is just another way of kind of showing the steps that we took over the last couple of years. But we did use the exact same procedures. So for instance, in the administration phase, we repeated the beta testing with a new group of students. And then we continued to use the same topical experts for feedback. Based on the second round of those steps, we ended up replacing a couple of more activities and added even more content on victim blaming. We also added the sexual experiences survey to the post-test. We administered the program again in September of 2016 to 57 students, and we found a large proportion of our small sample had been the victim of at least one form of sexual assault, and we saw improved scores in all of our measures, and especially in rate misacceptance. So the results are outlined in a little more detail here. So we did note that participants seemed to have a better understanding of sexual violence and what constituted sexual violence after the Relationship Tidbits program. And we continue to see changes in the scores on gender equality and rate misacceptance. And again, those interested, oh, go ahead.
I was going to say, great question coming in from the audience, Dr. Monroe-Kramer. Two questions. The first one is that the ADAPT-IT model seems to assume that we're starting with an evidence-based program. What this participant notes is that many universities have not yet evaluated their programs, and it may be difficult for them to identify which components of a program to adapt. Do you have any thoughts about that piece?
Yeah, that is a wonderful question. And as a researcher, one of the things that I'm very passionate about is working with your faculty colleagues or research colleagues to do an evaluation. Even a simple evaluation of how the program is working with a subsample of your student body, or if possible, the whole student body, will really let you know what outcomes you're changing, whether they be kind of knowledge, attitudes, or skills. I think there are quite a few interventions and programs that do exist that do have an evidence base, and so sometimes the adaptation process can actually be pulling components from different programs as well. So we took Relationship Remix and just used that, but we could have taken a part of Relationship Remix and then a part of a bystander intervention program and kind of combine those into one intervention or program as well.
So it sounds to me that campuses could be looking to different pieces of different programs, and that it can be useful to consider for adaptation programs which may have been evaluated locally but may not have the gold standard of the random controlled trial or perhaps even the quasi-experimental. Is that right?
Yes, that is definitely right. And the other thing I would add, I'm going to give another brief example here at the end, is that we don't always have to be taking from pre-existing sexual violence programs. So my second example of the ADAPT-IT process actually utilized a intervention that was developed for kind of reproductive health more, or sexually transmitted infections. But again, because of the framework that was underlying it, I was able to take a lot of the principles and make it work for sexual violence prevention.
Thanks a lot.
Thank you. So this is, again, for those interested in the research component, just showing the results from some of our pre and post measures for rate misacceptance and gender equality. Okay, so then the next step I wanted to focus on was the integration. So really what integration does is it brings everything together for us. And we ended this phase with a fully manualized version of the Relationship Tidbits program. And while at the time we thought we had a pretty good version, we were definitely aware that future changes might be necessary. The other thing I don't think I have mentioned yet is that the program is called Relationship Tidbits. That was something that was developed by the students in Ghana. That was another component we added during our assessment phase, was if we were going to create a program that focused on healthy relationships and sexual violence, what would the students want it called? And so they actually came up with that name during this adaptation process. So the results of our integration phase are that we had this manualized version of the program. Additionally, because it was a script-based intervention that was delivered orally to students, we wanted to ensure that the readability was appropriate, and so we also measured a reading level on our version, which indicated a grade level of about 8, which we believed was appropriate for our college sample. And this slide is, again, rather busy, but demonstrates the final version or the final building blocks in the relationship tidbits model. And the main thing you can see here is that we now have 10 building blocks. And so, as I had mentioned earlier, we did explicitly add a building block on gender equality before we got to the consent content, because that was something the students were really struggling with. If you look specifically at the main activities, you'll see it also mentions some of the activities that were changed, like the telephone game, and then adding the consented T video. So continuing to move along for time, the next phase is the training phase. And the training phase is really where we had the opportunity to get students from the University of Michigan and the University of Cape Coast involved. Now, again, this training doesn't always have to be students. It could be other types of facilitators. It could be training people to advertise the program or deliver it electronically. But for us, this was the student peer facilitators. And so what we were able to do is bring students from the University of Michigan who had experience and expertise in facilitating relationship remix to Ghana, and there they trained a cadre of master trainers. And the master trainers in Ghana, they are the ones that are now going to continue training other peer facilitators in the country to deliver this program. So the 6 University of Michigan students that we chose to be involved in this program, and we did an application process. I think we received about almost 30 applicants who were interested in participating in this, and we, but based on applications and interviews, chose to go with us. They were responsible for helping to plan the training. So they helped develop the training manual, which included developmental activities, resources, and address potential gaps, such as facilitator skills like answering difficult questions. They also were each responsible for delivering an hour-and-a-half-long workshop, and they had to think about how they would begin to evaluate learning outcomes. So the training topics that the University of Michigan students focused on were they gave a background on sexual violence in the United States to demonstrate where we were coming from and the terminology we were using. They did a Jeopardy-style game to teach about sexual health and techniques to educate others. They gave a program on self-reflection and identification of biases, led some skills workshops on just general facilitation skills, as well as redirection and handling difficult questions. And then they talked about self-care, which is something that really isn't addressed much in the Ghanaian context. And then a graduate student from the University of Cape Coast presented to us on the background on sexual violence in Ghana, and specifically at the University of Cape Coast, so that we were all aware of where each other was coming from. We received some wonderful feedback on the training session, which was good reinforcement for ourselves as well as the student participants, and also really informative in thinking about future iterations of the training. So the Ghanaian students loved having students their own age do the training for them. They are primarily lectured to in a British-style model, and so they were kind of sick of being lectured to by adults. And then the University of Michigan students really had a great time learning about sexual violence and prevention in another culture and context, and then bringing those lessons back to their role as facilitators in the United States. And so we're moving on to our last phase here, which is testing. So for us, the testing phase is actually currently in progress. Actually, like it's happening this week. And so what we are doing at this time is we're evaluating the final version of the adapted program, and it's being administered by the trained peer facilitators in Ghana. And so what this will do is it will give us feedback on if there are any last minute changes, It'll kind of demonstrate how our training went, and it's really going to prepare us and the program for scale up to the entire University of Cape Coast population. Our long-term goal for this program was to decrease sexual violence perpetration at the University of Cape Coast and enable all students to engage in healthy, satisfying relationships based on their values. And we developed this program so that it will be owned and maintained by the University of Cape Coast so that they can continue to deliver the program to achieve this goal. And as I mentioned, the final products that we really came out of this project with were a facilitator manual that has been culturally and contextually adapted, a facilitator's training guide that is really tailored to the Ghanaian students. And then we have a framework for administering this to the student body that can be repeated year after year. And so this really does provide the University of Cape Coast with the tools to administer an evidence-based primary prevention intervention that is sustainable and appropriate to their student body. And with every project, we always have some lessons learned. So ours were mainly about the adaptation process, and so I do think they're important to share. Adapting content to new locations and or populations requires engaging in an ongoing iterative process. And this was a little difficult at times because every time we thought we had a relatively final version, we had to make some more changes or someone had some more ideas. But we really do believe in the end that we came out with a stronger product. But there's also a point where, we aren't going to be making changes at this time while we deliver it to the student body. Working with the target population is essential. We really can't make assumptions, and incorporating the target population into the project is important and can happen in a variety of ways. And then we're always learning from the population, the delivery of the content, and new individuals. So it was important for us to continue to incorporate this new information and new learning into the program. And so I'm going to go ahead and take a quick stop just to see if there's any questions before I go into another really brief example.
Thanks, Michelle. Really quickly, a participant asked, says it seems the University of Michigan has an interdisciplinary team. Do you have any recommendations on how collaboration was established at the University of Michigan between student affairs, sexual violence prevention specialists, and researchers to be able to use this adapted model effectively?
That is a wonderful question, and I don't know that I know how all of the collaborations were formed, but I can definitely speak to the ones that I'm aware of. So as Holly mentioned, I was a student volunteer with the sexual assault program before I became a faculty member, and I basically remained in touch, and I definitely had some research interest while the Sexual Assault Center was growing with the programs that they were doing. And so we were able to meet regularly to kind of initially brainstorm and think about what we'd like to do, but then eventually to actually start to make some of those goals happen. Our university also does a lot of different kind of centers or groups focused on topics to help bring people together from different disciplines. And that is how I met Dr. Romanski and brought in kind of more of the medical school public health model as well. So I think it's just kind of reaching out to one another. Another thing we've done is we've started a small group that is focused on teaching and research around gender-based violence, and we were having monthly meetings. And it was a way just to meet people on campus who were doing work around this topic and learn what they were doing and sometimes form collaboration and ideas that could move forward.
Thank you.
Yeah. So moving on to another example, I'm going to go through this one a lot quicker since we've already gone through the whole ADAPT-IT process, but I really wanted to provide you an additional example of the ADAPT-IT model using a technology-based intervention that is happening in the United States. And so on the left-hand side of your screen, you can see a smartphone which displays Icon. Icon is a web app that uses a life skills approach to address testing for sexually transmitted infections particularly HIV, among men who have sex with men and transgender women in Southeast Michigan. And really quickly, a web app is designed to be used on computers, laptops, tablets, or smartphones. So the ICON web app was developed using a community advisory board that represented the views and needs of the target community. And then it ended with this kind of tile format where you can click on each tile to learn more about the content, to make personal goals, and to get resources on those topic areas. So I'm currently using the Adapt It process to adapt ICON to focus on healthy relationships and sexual violence among college students at the University of Michigan. And while these may seem like very different focus areas and populations, I was actually able to reuse a lot of the content and structure because I continued to adhere to the life skills approach. So this goes back to one of the earlier questions. I think it's important to recognize that for both of these examples, the frameworks or approaches of the intervention, it ensured success in the adapted version. And so for relationship tidbits, we did adapt a sexual violence prevention program, but the important thing was that it used a values-based framework, and that was translatable to a new country. For this, we're calling it the MKIT adaptation. I was continued using a life skills approach. And even though the original intervention didn't focus on sexual violence prevention, that life skills approach was able to be maintained in the sexual violence version. Again, this is one of those slides you may want to come back to in the future, but I did use the Adapt It process the entire way as well. The things I want to point out here is that it was a much more streamlined process, and I was able to do this much more quickly in our Ghana study. The other thing that I did is I purposefully included a community engagement point. And so the very first thing you can see at the top of the slide is before I even started the assessment process, I engaged university staff and administrators to get buy-in to the idea and to help facilitate the process. And I called those individuals my technical expertise group. And then during the assessment phase, I also formed a student advisory board. And they were really the voice of the students. And they made the final decisions on kind of the look of the app, the content that was to be included, and really were the voices of their classmates. Both undergraduate and graduate and students were included in that student advisory board. And then you can see that further down, I reintroduced that community engagement piece to help them review the beta version of the web app. Because we were developing an app, as you can imagine, it's a little bit more time intensive with a tech company, and it is costly. And so I wanted to take some extra steps to ensure that the content and resources we were putting into the app were appropriate and were going to meet the needs of the students, but also be consistent with university programming. So when we compare relationship tidbits and MKIT, and the red logo that you see is actually the logo that was developed for relationship tidbits by the University of Cape Coast in Ghana. So you can see that both processes use that Adapt It model to adapt the intervention to a new context or culture or population. The relationship tidbits adaptation definitely took a longer period of time and even required a second round due to the significant changes needed, whereas the MKIT adaptation used a more intensive community engagement process that included a technical expertise group and student advisory board. Additionally, relationship tidbits is a script-based intervention delivered by peer facilitators, while MKIT is a web app intended to be used to reinforce pre-existing primary prevention interventions. And so I think their differences really highlight the diverse application of the Adapt It framework in regards to different populations, cultures, contexts, and even types of interventions. And so for the last couple minutes here, I would like to just briefly go over, we've gone through some examples where I have used the Adapt It model, but I'd like to spend the end of this webinar thinking about how you could potentially use it. I truly believe that this process can be used for new student populations, like international students or adult learners. It can be used in new contexts like community college or commuter colleges. or new locations where a sexual violence prevention program has not been introduced. And so I think this program really can be helpful when you need to save money, to save time, have limited capacity, or have a unique population, context, or location. And so some of the keys that we've learned to a successful adaptation are really knowing your population, engaging your community, and this could be a formal, student or community advisory board, or just getting feedback from individuals along the way. And then thinking about your timeline. One of the things we ran into in Ghana was the academic calendar. When we were able to travel to Ghana, that is when they were often on break. And so really planning when are your students available and what is realistic to get done given your other obligations and your workload. The other keys are building a team. So I wanted to reinforce again that researchers are always looking for projects to be involved with, and so they can be really helpful when thinking about evaluating data, thinking about campus housing or facilities or others who might help logistically enable a program. And if you are going to have a technology base, do you need a technology partner? Identifying financial support in the terms of human resources, as well as finances to fund the program and for sustainability. And then finally, making it your own. So the adaptive process creates a unique program based on your population, location, context, and needs. And it uses a pre-existing program only as its base. So this really allows you to conclude the information, the naming, the branding that is most appropriate for your institution and your population. So I'd like to see if there are any final questions that I can answer for anybody.
Unfortunately, this has been so wonderful. We are out of time, but any additional questions that participants have, please put them right into that question box, and we'll make sure that we answer those questions offline. Thank you so much, Michelle, for this truly wonderful presentation. I think for me, having a systematic framework to take interventions either based on, intended for sexual violence prevention or for other kinds of harms on a community campus, and being able to go through a framework to appropriately and conscientiously adapt them is an invaluable contribution to the field, and I'm really grateful that you were able to share that with us today. And I'll go ahead and turn it over now to Michele to close us out.
Thank you, Holly, and thanks so much, Michelle, for this amazing presentation today. Obviously, Holly, thanks for inviting Michelle and supporting her in this presentation as well. Absolutely great to see this use case that I'm pretty sure has given our audience a great insight on what a good process for this kind of initiatives look like. And also, I love the part with the takeaways that people can actually apply to their own context. So thanks so much to both of you for bringing this to us today. I just want to quickly, as usual, mention our last housekeeping items. We have received a couple of questions right in the last minute. Yes, a copy of these slides will be made available to you, along with a full recording of this event today. So you will be receiving that in a follow-up email. I also wanted to mention that EVERFI as a company has its own sexual assault prevention program. So if you're curious to see what that looks like, we'd love to give you an opportunity to. So to do so, please just go ahead and type demo at the right-hand side of your screen so that we can see your interest and then have somebody reach out to you and show you around. Again, that is demo, right-hand side of your screen, if you wish to see what our courses look like. Lastly, I want to mention that as you log off of this event, a short quality poll will initiate. That is how we collect your feedback on what you thought about this event. It takes about 2 to 3 minutes to complete. We do value your feedback greatly, so if you could be as kind as to fill it in, that is extremely valuable to us, and it helps us bring you only the events that you really enjoy and care about. With that, I would like to, again, thank one last time Michelle and Holly for the amazing event they put together today for all of us, and also thank all of you that have been live with us and have been engaging asking questions. It really makes our day to see that you are engaged in the topics that we choose and how much these are important for you. So, keep coming back. We have more events coming up this and the next month. So we look forward to seeing you live on EVERFI webinars again. Thank you very much, and we'll be in touch with a copy of the recording and the slides. Thanks again.